There are two major approaches to gathering information. You can undertake a research study and collect the information you need from primary sources, such as surveys, interviews, focus groups, etc. And this is called primary data collection. And sometimes there is data already available that can be utilized, which are called secondary sources, and your research process can be a secondary data analysis. Most often, secondary data is quantitative. It's statistics. It can include qualitative data, but we'll just focus here on the large amounts of quantitative data that already exist in which we can use in our social work practice, in our advocacy, and in our activism. Using existing statistics for research can be a form of unobtrusive research. So why would we want to do this? I may have already mentioned that while I've been engaged in community-based research for most of my social work career, I have been and remain to be a reluctant researcher. I know that participatory research can engage people and communities in processes for social change and social justice. But if engaging people in social change and social justice are the main objectives, I can think of many, many better ways to do that rather than undertaking a research study together, such as join or start a social movement, for example. So I do recommend knowing what existing research can be utilized by communities. Typically, communities don't have much or any funding to conduct research, so it's good to learn some skills on how to beg, borrow, or steal existing research from better funded agencies. And what I like to do the most is to take existing evidence from a mainstream source and creating new knowledge based on new analysis from a community or activist perspective. So I'm going to just present some of what I see are the benefits and limitations of secondary data analysis. First, the benefits. So, primary research, such as interviewing and surveying people, can be time-consuming and take resources away from other work, like direct services. Whereas secondary analysis can be an approach that is very cost-effective, very time-relevant, and compared to collecting the data yourself. You've likely heard the expression research to death. Another advantage of secondary data analysis, rather than collecting new data, is to not have to make information demands on over-surveyed groups or on people who use your services. Existing data is often high-quality data, not to be rude, but better than what you and I might be able to collect. It's simply about resources. Governments and agencies such as Statistics Canada have way more resources than a small local social service agency to conduct high-quality surveys and expert analysis. You may be able to use data that is generally accepted and credible, and dare I say, unbiased. For example, funders may accept your use of Statistics Canada data as more credible, rather than you conducting a survey in the neighborhood and not being able to defend the sampling or the generalizability. Secondary data also allows for comparisons, such as subgroup analysis. How does the subpopulation of folks you are interested in compare to the general population? What inequities, inequalities, and disparities exist when you compare existing statistics? Also, comparisons over time are possible, so-called longitudinal analyses, as you look at the cost of living or on welfare rates or HIV statistics over the last 10 or 20 years, for example. Secondary analysis offers an opportunity to put positivist data under a critical lens and the possibilities of offering new interpretations of data. You may look at relationships that have not been compared before, for example, or just localized data, as is done by many United Way agencies and community social planning councils. Now, some limitations. There are limitations to be aware of when conducting secondary analysis of existing statistics. We may, first of all, lack a familiarity with the data that we are using and what its limitations are. For example, many federal government surveys do not include those living on reserve, which in some areas can mean the data for a local area omits a significant number of people, and potentially people you are saying need to be prioritized. We don't have control over data quality, and we may not know what quality issues there are. For example, what was the response rate? Was the survey method a phone survey or a mail survey, etc.? Sometimes existing data is complex and we lack the statistical knowledge to engage with the data and credibly defend our claims. Because our work is often with groups that are marginalized, the groups may actually be absent from the existing research, or the key variables that we may want to report on may not be in the existing data. As I mentioned, on-reserve populations are often excluded from federal surveys, and similarly we may find that incarcerated people are excluded, and that people who are without homes, those on the streets and in shelters, as well as in hospitals or in treatment, etc., may not be included. Also, key variables that are of interest to your research question may be missing. For example, population surveys can often not well capture populations within the LGBTQ communities that, even when reported on, may not distinguish between trans and gay and lesbian, and may not well capture bi and non-binary defined respondents. Also, variables may not include issues related to trauma, and may not capture impacts of stigma, or may focus only on negative variables and not on variables reflecting well-being or resilience, for example. Also want to just mention that secondary analysis can be conducted quite often with agency statistics. There's existing data within social service agencies and programs. For example, program statistics are likely the most obvious and most often used for program evaluations, needs assessments, and within proposals for funding. Obviously, caution is critical here to ensure that ethics and privacy issues are fully considered. I suggest that if there's such research is to be undertaken, it is best to plan how to collect the data with this purpose in mind, rather than to look at the existing data after the fact and wonder what can be done with it. I find the most frequent limitations of agency statistics is that service providers collect the information with the intent of collecting what information is needed for the best service delivery and case notes, and not particularly program reporting, and the data is often incomplete. Finally, just a note that secondary analysis can include document analysis, which is another form of unobtrusive research. This can include policy analysis, an analysis of legislations, practice guidelines, etc. I've used this method to analyze service plans and annual reports of provincial ministries over the years. Thanks.